Hey everyone, this is Kieran. Today's exercise is looking at a more advanced neck flexion exercise. So this is going to recruit all those muscles that flex the neck. So we're looking at longus capitis, longus coli, sternocleidomastoid that flexes the head on the neck. And you're going to get some accessory stuff kicking in as well, maybe through some of your high weights, for example. Good progression to eventually get into. What would this help? Your ability to look up to the sky. So if you feel like you've got restrictions in looking up like that, then this would be a nice exercise progression for you. So I'll give you guys a couple angles to look at. Just a quick sort of short precursor on like who this could be useful for. I know we talked about the range restriction in the intro, but I see this commonly used a lot with, say, like post-whiplash patients, concussion, people who've had like a trauma around their head or their neck. Neck sprains that are on like a low grade, you don't necessarily see this kind of range loss, but for a lot of people that have had these more severe neck or head injuries, you do see the range loss persisting. And that's a thing you see with any injury, right? If you hurt your knee or your ankle, you might lose some flexibility. Doesn't necessarily mean it's a permanent thing, but you do need to do some rehab to try and regain that flexibility. And for those whose environments or activities don't demand it of them, they may not get that flexibility back just because they're not using it. And maybe they haven't used it through avoidance of maybe fear of making it worse or causing pain. And not having the confidence to sort of push into some of those barriers and regain your range. So, when you look at things like a whiplash, I'm not so much sure with concussion, but when you look at a whiplash, you're going to see that things that make symptoms persist over time tend to be more psychological factors, like if someone's feeling anxious about their injury, or maybe they have a predisposition to, feeling down about things. These types of things can make someone's symptoms persist longer than necessarily the injury to the neck, because you see these things continuing to persist at 9 to 12 months, and actually the tissue's healed by that time. So why is this restriction still there? Or why is this feeling of threat or damage? So these are some of the things that might, you sort of come up when you're trying to do an exercise like this. You might feel some threat. And I wouldn't necessarily jump into this as the first exercise you do. I'd be looking more at my cervical endurance exercise, and I'll put a link up here. It's a good starting point. And then as you get confident with that and you can hit the baselines for that as far as testing endurance scores, then you come into this kind of exercise, okay? It's also a really useful exercise for building upper thoracic extension. I haven't really found many other exercises that consistently get someone to feel that area. So it's useful for a couple things. And that's a flexibility requirement that's really good to have for developing full retraction of your shoulder blades. You need those rhomboid attachments up in those upper thoracic vertebrae to be able to, leverage off of an extended spine. And if you haven't got that, then maybe you don't get full range. So you lose out on some potential pulling power. Okay, so exercise. I'm just going to show you on this angle, and then I'll show you a different one. So I'm going to lay right on the edge here. So my shirt collar is sort of hanging off a little bit, and then I'm just going to drop down. I might actually, let's bring this more to the middle. So if I'm there, and I'm just going to drop down and come back up. And I'm really trying to just emphasize the neck and the head movement. If you're trying to be particular about the technique, use some external stuff. So fixate with your eyes. So for now, right down here, my full range, I can keep my eyes locked in on a particular object that's sort of stood out to me down there. And then down here as well, there's a particular thing that stood out. So every time I go back and forth, I'm going to find that object with my eyes. And that'll help a little bit with maybe some of the dizziness that someone gets. But it'll also ensure you're going the same range every time, okay? For a lot of people that need this, they really don't need many reps to start with. You might start with like 5 reps and you'll get quite tired and you'll get some neck workout soreness, some DOMS the next day. A few sets of 5, see how you feel. If it's okay, then a couple days later, do it again every week, maybe add a rep.
So over 10 weeks, you might get up to 3 sets of 15. And that'd probably be sufficient, and your range would probably have returned by then. For those that need the flexibility through here, they might be able to push that a bit more to start with, and you're looking to really try and look more this way. So if I really maximize it, I'm trying to look down at the ground, down here with my eyes, and that's gonna ask that upper thoracic area to really have to extend, okay? As I come back up, you don't have to, but if I put my hands under here in my lower back, and as I bring my head up, I tell myself, don't squish my hands. If I do that, then it means my neck has to do a bit more work. If I allow my hands to get squished, then my abdominals are helping and I'm doing a bit of a crunch. Again, not a bad thing, but it just takes a bit of the focus away from the neck and kind of pushes it into the tummy. All right? So just from a different angle for you guys to see. Let's go bang on. This will be a bit of a funny angle for you guys. But if I just come here just for the visual. So same setup, you guys can see I'm right at the edge here. And I'm allowing myself to come down and then back up and down. Okay? So simple in execution, but the entry point to doing this, you do need to have some prerequisite strength and endurance. And it's not necessarily that you're going to hurt yourself, but sometimes the sensation that someone gets, say a workout soreness that's mechanical in nature, well, it stemmed from a mechanical movement, that alone can be alarming enough for someone to not want to do it again. Even though maybe it was perfectly safe and they'd recover in a few days and they'd be able to do it again, the experience of that sensation previously might have been alarming and impacted their lives in other ways. And so the replication of that, or if that were to happen again, can be enough of a motivation to not continue doing it. So one, being aware of that and expecting a little bit of that to come, and then two, erring on the side of caution and doing less to start with and having not so much of a negative reaction, and then you can do a little bit more and build up. And over time, you'll be able to get that back, and you'll be able to then look up to the sky much more easily, and you'll also be able to get the full retraction. That full retraction is those collarbones being able to go all the way back. I need that extension up through that upper back area. So nice progression, good exercise. Not everyone needs it. How do you know if you need it? You look up, it's hard for you to get all the way back, or you feel restriction through the front of the neck, or you feel like you haven't got extension or ability to fully retract your shoulder blades when you're doing like a row, for example. So give this a go, start slowly, do less, and over time increase slowly, and you'll get stronger and more flexible through your neck and head. If you like this video, then please hit like below. Otherwise, to check out more of our content in the future, you can subscribe to our channel by clicking our logo over here. And to check out our latest video, click up here.